Now, would you rather, I mean, you're in Beverly Hills right now, but would you stay in Beverly Hills, LA, or would you want to go back to Miami and operate there?
I love Miami, don't get me wrong, but definitely with that question, it would be Beverly Hills.
I was expecting that answer, because if he was about to say Miami, I was gonna be like, it's like Mexico 2.0.
Yeah,
I tell people that all the time, and I feel like some people know and some don't, but definitely 2.0.
Yeah, unfortunately, there's a lot of things down there that is not controlled for. There's not a lot of oversight with these medical clinics. A lot of them are clinics where there's not even a board certified surgeon, a registered nurse.
So scary that people even try to like do plastic surgery like that.
Yeah.
It's wild.
Don't get me wrong, there are great places down there. For the most part, a lot of patients like to go there, from my experience at least, and what I've read, because it's cheaper surgery.
Yeah, but literally you get what you pay for. So if you're paying $8,000 for 360 lipo BBL and a tummy tuck, that's a problem.
Yeah, because those surgeries don't take an hour, right? They don't even take 2 hours.
Hell no.
They take several hours. So you're paying for operating room fees, you're paying for anesthesia fees, you're paying for the nurse. You have costs. So
literally,
there has to be a catch to why it's so cheap. And a lot of it is the staff. A lot of it is, rushing the surgery.
Yeah.
Things can go wrong. It's your body,
Yeah, 100% way more complications, especially when the standards are very different. And also, the surgery's janky, and then they're going to a janky aftercare. So the whole process, you're just at higher risk for complications, and people don't think about that, which is so wild.
It's funny, I actually saw a video of someone zooming in on a building in Brickell in Miami. As you get closer, you see a surgeon and a tech operating on someone in an apartment.
Stop.
Yeah. And
oh my God.
Yeah, it's on Instagram. It's like,
that's wild.
I can only do what I can do, and I get a lot of patients calling the office or filling out a form saying I want a second round, or I want more lipo, or a lot of times I get patients asking for revision lipo.
I was gonna say, we see a lot of revisions coming from Miami, like a ton coming to LA or Beverly Hills. I mean, we are the capital of plastic surgery. So.
Yeah, people want to remove all the fat and they want to look great, but there's a lot of safety concerns. I don't blame them. They don't know. They're not in the medical field.
Yeah.
And when they're not well informed from either the surgeon or whatever medical team that they're seeing, it's unfortunate. The worst thing is when they get the surgery and then they come to me or they go to other surgeons.
It's a hard fix.
Yeah.
It really is.
If they don't have the money, maybe wait a little bit.
I always tell patients that everyone's in a rush to get snatched up. And it's just like, wait a little bit longer, whether it's a year or a year and a half, save up the money, because the investment is way better.
Exactly. So speaking of Miami, I have a story time. There was this guy, he was, I'm not sure where he was from, but he was on bath salts, he was on drugs.
Okay.
And he was hallucinating off the drugs to the point where he attacks a homeless guy.
Oh no.
And he starts biting him, literally biting him and eating him and biting his face off. And it got to a point where all the tissue, or most of the tissue from his face, was like denuded and removed. So he came into Ryder Trauma Center. I was a trauma resident at the time, and the plastic surgery team had to, intervene.
Call plastics.
Yeah, so he basically didn't have a face. His nose was ripped off, his scalp was ripped off. It was pretty brutal. And I remember that they had to do like at least 5 or 6 operations to kind of reconstruct his face.
I'm sure.
And that guy was, in rehab for a long time. He was pretty
messed up
from that
attack
and the surgery.
Speaking on photos and patients, a lot of people are scared of doing befores and afters. And I feel like, honestly, really helps other people and other females, especially if you see this patient with this body type and, oh my God, she looks like me, and Dr. G can make her look like this. So I feel like maybe letting patients know and people know that before and afters are kind of needed. Like it's pretty important.
Definitely. I tell patients that at the end of the day, it's their choice. But I think one of the issues with it is that a lot of them come in, they're a little embarrassed from their befores.
And I understand.
And it's only after the fact that they look great and feel great, and then they're like more confident and they're like, okay, you know what, I'm okay with that.
Yeah.
But it's kind of hard to show them that until they get the surgery.
Yeah. And I always tell patients, well, you were scrolling on his Instagram trying to find a body type like yours, right?
Yeah.
So it would be helpful if we can use your before and afters, cut out your face, take off your tattoos, take your befores and afters, ladies. Help the fellow girls out. So I feel a hot topic. BBLs in LA or BBLs in Miami? What's your take on it?
I think it's very different. I think there's
100%.
definitely a cultural aspect to it. And it also has progressed and evolved over time. So I have a really funny story. Actually, I was relaxing at the Mondrian Hotel in South Beach with one of my ex-girlfriends.
Oh.
She sees someone get out of the pool and she's like, babe, look at that. I'm like, what? And this is kind of before I was a fully trained plastic surgeon. And she's like, her butt is so big, it's like you can rest a cup on it. It's like a shelf. And I look and I was like,
The fact
oh my
that he
God.
looked, no, I'm just kidding.
No, I mean, I had to look. She told me, she asked me to look, and I look and I'm like, all right, that's not nice, that's not normal. But some people want that.
Yeah, some people want a big old booty, so.
And what I didn't realize at that time, which I realize now because I see a lot of these patients post-op years later, is a lot of that fat can start to sag with time. So when I saw that, I was like, I don't like that. That's not my style, but to each their own, you know?
Yes.
My experience in Miami was seeing a lot of that. A lot of what we call, upper pole shelf. Really, really wide hips.
Wide.
That don't look like she just worked out. There's obviously some plastic surgery there. In LA, I think it's like not exaggerated, but there's a different emphasis on where the fat goes. Buttocks and hips look different in terms of a little bit more athletic looking in LA.
Yeah, I was gonna say, we kind of see more of like an athletic BBL, whereas Miami, you see a stripper BBL. Like that's what it is. That trend in LA, everyone wants to still be fit, still be toned, still go to Pilates, but still have a nice butt.
I talk about shapes all the time, right? Buttock shapes, A shape, O shape, B shape.
Yep.
In Miami, they're very much so O shape, but like exaggerated O shape,
Yeah.
whereas in LA, it's more of an A shape or like a pear shape.
A pear, yes. I feel like the O shape, it makes you look bigger. It makes you look big. It doesn't make you look snatched. The O shape really makes you look like you still got to lose 20 pounds.
Especially if you have a shorter stature, it kind of takes up your lower body.
100%.
So it doesn't give off the effect like your legs are elongated or you're taller. It kind of shortens you.
So I see a lot of patients firsthand where they go to Miami, they get their body done, they do look snatched, but their hips are just so big that they're freaking out. Because they're so used to being like so tiny and focused on a size small that they get out of surgery and they have great curves, but their hips are so big, now they're a large. And I feel like that really plays on someone's mental health. Like, especially if you're already having some type of body dysmorphia previously about having to be tiny, having to be toned, and you go get this surgery and you come out with huge hips, it really plays effect on people. And then they're coming back and trying to get revision lipo where we're taking fat out of the hips. And I feel like you really have to understand what you're getting yourself into and really let your doctor know what you want, what look you're going for. And definitely it's important because afterwards you think you're going to be happier with yourself and sometimes you're not. And it's so sad seeing patients like that.
Yeah, that's a good point. Whenever I see patients in consultation, I discuss that with them. You know, how much fat do you want? You want mild, moderate, severe? Where do you want it? I also do the vector machine, which is a 3-dimensional machine that gives them, I would say, upwards of 95% confidence of what you're gonna look like. And I kind of show them, do you want hips? This is what it's gonna look like. Do you not like it that exaggerated? We'll make it smaller. And then I do a cover the plan where they come in for the second visit right before their surgery and we discuss it again. And then morning of surgery,
we discuss it again.
Yeah, I mark them, I show them what the markings mean. This is what it means. This is where I'm gonna inject, how much I'm gonna inject. So yeah, you have to really be very, very transparent with patients and inform them.
And before you're getting cosmetic surgery, you know, you're just thinking, I'm gonna look great. Oh my God, my body's gonna be snatched. Like, you really have to get into a headspace. You're changing almost your whole life. It's your body, right? You're gonna look different, you're gonna feel different, you're gonna act different.
And that's why research is important, right? It's not just looking at before and afters, it's also doing enough research so your mindset is.
And another thing is people are looking at these influencers and these girls on social media who are snatched up, they got cake, they look good, and they're like, I wanna look like her. And they're tiny little girls that wanna look like these influencers, and then they get these big old bodies and they don't know what to do with it and they're freaking the hell out.
Well, you know, that kind of ties into expectations because I have patients coming in where they have very realistic expectations versus others who you know, they have a lot of loose skin, they're severely overweight, and they want to look like someone with a BMI of 23, 24, tight skin. It's as if, you know, they want to reverse the process of aging, the process of pregnancies. And, you know, unfortunately, you can't do that, right? There's just some stuff that God or whoever you believe in, or, you know, it's just your anatomy.
And if you've had multiple kids, if your BMI is greater than 27, 28, and you're just getting 360 lipo and BBL and think you're going to be snatched, no. Or debulking, you're going to have excess loose skin, kind of need a tummy tuck if you want certain expectations. And people think, oh, just lipo me up, suck out the fat and throw it in my ass. And it's like, no.
One of the biggest things I come across is patients who have been pregnant, who are over the age of 30, definitely have a BMI above 27, and they think lipo means just more than sucking out fat. They need tummy tucks, and they don't want to hear that word, but I'd rather be honest with them and let them know, if you want this kind of result, that's what you need.
This,
right? To me, it's like, you want to go through one recovery or two.
Because you're going to come back. More than likely, patients always come back.
A lot of times when it's related to money, it's more like, okay, you have to realize that if you're going to come back again, you're going to actually be paying more.
You're paying for the anesthesia. You're paying for the OR time. You're paying for the facility. There's a lot of stuff that you guys don't know where that money goes. It doesn't just go all to him. Okay, so what do you think is a big, I would say, scam that people are doing? And you already know what we're talking about. What is a big scam that you see that you're just like, why are you doing this?
Awake lipo.
100% awake lipo.
Yeah, it's
scam of the day. Air sculpt, awake lipo, scam.
Yeah, I understand why people are interested in it, right? It's like less downtime.
Not even less money. Some places are charging the same as if you were going under.
Yeah, and also, what's the other one that they always talk about? Less invasive, they use of the term, or it's safer. And honestly, I would be scared to be awake on the table than asleep. People don't understand, when the anesthesiologist put you to sleep, they have 100% control if something serious happens. Where awake lipo, if shit goes down, then they have to intubate you.
It's a lot more serious if you're awake. It's almost safer if you're asleep, and everything is controlled by the doctor.
Yeah, you know, a lot of patients have had great experiences, don't get me wrong, but I've heard many, many stories where, you know, they're not awake, first of all. It's kind of like a twilight zone.
Conscious sedation.
It's kind of like when you get a colonoscopy. So some people have heard what everyone was talking about. They remember it was traumatic for them. They felt it. Right? Even you can't control for all the pain when you're awake, no matter what you do. So they felt it. But you know, what's important for me is getting the best results for patients. And I've had many, many, many people come in saying, I got awake lipo and I don't like my results, I want more. You can't be as aggressive when you're awake.
And you can only pull out, 5 liters of fat during awake lipo? And that's, I mean, it's kind of a lot, but it's not that much. Especially if you're a higher BMI.
Yeah, because those 5 liters, remember, is aspirate, which is not just fat.
True fat.
There's tumescent fluid, there's little fibers in it, there's oil, there's stuff that makes up that aspirate. Not all of it is fat.
So they're paying $15,000 for awake lipo, and you're only getting 5 liters out, and you wake up and you're like, what the hell? And no, you should have just went and got full-on 360 lipo BBL, or no BBL, just the lipo, and got better results.
And that kind of goes back to, all right, now they have to come back, second operation,
more money, more time.
All right, so one of the biggest things I'm asked about is fat. Is it safe, right? Versus implants, and it depends on breasts and butt. So my take on it is, first of all, your fat is safe. You cannot get someone else's fat, right?
No.
You will reject it very quickly, and it can be very dangerous, and you can potentially die from that. We don't do that. I don't know anyone that does that.
Yeah, I was gonna say, I haven't heard, seen, or that's not a thing.
But your own fat is what's called autologous, which means it's your own. It's safe. When it comes to the butt area, I definitely think fat transfer is the way to go.
Yeah, no booty implants over here.
The implants, there's a lot of complications.
And they just look bad.
Yeah, they look fake. Horrible. They don't look real.
And the touch, the feeling,
it's like hard.
Not cute.
Importantly, a lot of them can rotate. You can get a lot of infections where you have to remove the implant. It can become a disaster.
Yeah.
When it comes to breasts, though, I do fat transfer to the breast, but it's only on a select few patients. And the reason is because a lot of that fat doesn't survive, right? 40% of it. But also, it doesn't add that shape that people are looking for with the breast augmentation. People that want a breast augmentation want to get at least a cup size bigger. They also want fullness. They want some cleavage. They want some kind of roundness and improved shape. More of a lifted look, right? When it comes to fat transfer, what's going on is that you're just putting fat in to the native breast and you're just making a little bit fuller. Yeah,
your breasts are still sagging, they still look the same, but they look a tad bit bigger.
Someone who's very petite, who, you know, they're getting liposuction, they don't want to discard and throw out all that fat. They just want a little touch to their breasts, a little bit more fullness, fine. But if someone is a little bit on the bigger side, not so petite, they actually
and you have excess skin, you got to throw an implant in there.
Well, they need a lift too with that.
A lift and an implant,
So there's a lot of things that go into it. If I had to pick, it would be fat transfer for the buttocks and implant for the breast. So I think 2023 was a great year, but you know, I'm hoping for 2024 to be a better year.
Definitely.
For me, you know, social media is great. I love educating patients. I love informing them of what they can expect, what things mean. You know, every Thursday I have a Q&A where they can ask me anything.
Giving them so much more insight.
Exactly. But you know, with the whole Meta and Instagram, there's a lot of rules and regulations that's really hindered me as a plastic surgeon and a lot of my colleagues where
I've heard about that.
Yeah, they shadow ban us. They don't allow us to show a lot of stuff, or we show it, but it doesn't kind of get
pushed out
to the right people, and that's unfortunate, right? So I want to show my before and afters. You know, we do the best we can. We blur out any nudity, but at the end of the day, it's for medical purposes, you know, and the fact that we can't show it is kind of something that I'm trying to
it's difficult. And I think a lot of other surgeons are messing it up for the actual surgeons who are really trying to get medical knowledge to patients and you know, doing TikTok dances while their patients are asleep on the table and having complications and just messing around and using it more for clout and not using it for actual medical purposes. And I think it's messing it up for you guys.
It's, you know, it's patient safety first, right? So we got to make sure patient is safe, everything is done according to standard protocol, because that's the most important thing. You know, everything else is, you know, cherry on the top. So if I do lives, if I do stuff in the OR, you know, I'm always looking down, I'm always operating.
You're just explaining what you're doing.
Right. So there's a lot more we can talk about, right? There's tons of material out there.
Definitely.
But I think a good thing to talk about next time would be about BBLs, maintenance, what to expect after, and how to keep your results. Because I have a lot of patients coming back, you know, complaining, why does this look like this and not like that? And there's a lot of things that people have to really pay attention to kind of maintain those results.
Yeah, definitely. People are just getting BBLs and not keeping up with them, and then their asses to the floor.
Yeah.
It's a cliffhanger for you.
Good.